Welcome, everyone. We are delighted to have you here on this Monday morning, starting a new week together. I am Katie Schubert. I'm president and CEO of the Society for Women's Health Research, and SWHR is the thought leader in promoting research on biological sex differences in disease and improving women's health through science, policy, and education. And we really appreciate you, your attendance, and for joining us for our Focus on Fibroid series. Today's webinar is Empowering Women Through Personal Journey Telling. We're pleased today to have three distinguished panelists joining us for this event. Two distinguished panelists, my apologies. Dr. Soyini Hawkins, who's not only a fibroids patient, but also a minimally invasive gynecologic surgeon at the Fibroid and Pelvic Wellness Center of Georgia, and Sateria Venable, patient advocate and founder of the Fibroid Foundation. I'd also like to thank the sponsors of today's event, AbbVie, Myovant Pfizer, and Roche. And as always, we are live tweeting during today's event. We invite you to use the hashtag SWHR Talks Fibroids on social media. At this time, I'd like to introduce SWHR's Director of Science Programs, Dr. Irina Ninye, who will be moderating today's event.
Thank you, Katie, and welcome everyone. Uterine fibroids, or leiomyomas, are non-malignant growths of the uterus and one of the most common gynecologic conditions nationwide. More than 80% of Black women and nearly 70% of white women have fibroids by age 50. There's limited data on prevalence and impacts of this disease on Hispanic, Asian, and other women of color. However, we do know that while some women have fibroids and experience no symptoms, others can experience menstrual bleeding, pelvic and back pain, and challenges with infertility that can significantly affect their daily activities. Unfortunately, women with fibroids can also experience delays in diagnosis due to stigma around menstrual disorders and normalizing abnormal symptoms that occur among both patients and healthcare providers. SWHR's Fibroid program was founded to draw awareness to research gaps and unmet needs in clinical care, education, and policy concerning uterine fibroids. With the guidance of expert researchers, clinicians, and patient advocates in the fibroid and gynecologic health space, SWHR has developed an online patient toolkit to increase awareness and understanding of uterine fibroids and help individuals with fibroids navigate their care. Today, we have two members of our Uterine Fibroids Working Group with us to continue our Focus on Fibroids series, empowering women to live well with uterine fibroids. And they'll also share their insights as to how we can better understand uterine fibroid disease and strategies as to how they manage their fibroid wellness at various stages in their life. Following the speaker presentations, I will be moderating a discussion with all of our panelists. So we invite you to use the Q&A box to submit questions throughout the event. We'll start with Dr. Soyini Hawkins, who will share her journey living with fibroids, including fertility and pregnancy, and how she navigates this work-life health balance, especially from the perspective of being a clinician in this space, while also being a fibroids patient. Thank you for joining us, Dr. Hawkins.
Thank you, Irina, and thank you to SWHR for just continuing the conversation on this very important topic, and I'm continuing to just unmute what fibroids is, educating the public, and also being the voice of pushing for more research, because research obviously is going to help us answer more questions over time and give us more pathways to allow women to understand how best to live with their fibroids. So again, my name is Laney Hawkins. I'm a minimally invasive gynecological surgeon just outside of Atlanta, Georgia, at the Fibroid and Pelvic Wellness Center of Georgia, which I founded, and I'm the medical director of. And I'm not only a provider for many women who have all kinds of gynecological ailments, from fibroids to endo to cysts and things that cause pelvic pain and discomforts, but I also am a fibroid warrior, is what I like to call it myself. I have my own fibroid journey and story, which speaks to everything that Irina just talked about. It speaks to work-life balance and how I was able to try to gracefully live with my fibroids until I couldn't. Its impact on my fertility and my relationships, because that's a part of it, what it did for myself, my husband, and even my children currently, and also a lot of how to monitor symptoms and the changes that can happen over time with fibroids that a lot of women are sometimes conscious of, but sometimes very much oblivious to. Sometimes, honestly, until they get their fibroids taken care of and they're like, oh, that's what was causing that back pain or making me wake up in the middle of the night constantly to use the bathroom. So my fibroid journey started about 11 years ago. And I came on my diagnosis very atypically. Typically, fibroids, which are benign tumors of the uterus that grow, are usually associated with most commonly heavy menstrual bleeding. Some patients will have that and pain and bloating, or one of the top. Those are the top symptoms that are encountered. When I was diagnosed with fibroids, I had pain for one day, and my fiance, who's currently my husband, but fiance at the time, said, woman, get that taken care of. You don't have pain. That's not your typical you. And so I did. I went to the doctor and I saw a practitioner that day, and she said, oh, maybe it's your fibroids, or you could have an ectopic pregnancy. I said, well, first of all, I'm not pregnant. Let's get that straight. But then what fibroids? I was just here 3 months ago and did my annual exam, and he didn't say anything about fibroids or that my uterus was enlarged. And she said, your uterus is 16 centimeters. A normal size uterus is about 8 centimeters, 8 by 5 centimeters, the size of your fist, essentially. My uterus at this point was double the size, and I had just had a pelvic exam. I was not having heavy bleeding. My pain went away after that day. I didn't have any bulk symptoms, and I had no idea I had this thing growing in me, and it certainly didn't grow overnight. I was at the end of my training in medical school at Morehouse School of Medicine and transitioning to live in a whole nother area in Baltimore, Maryland. And when I went to Baltimore and told my professors there and attendings at the time what had happened, they said, oh, well, what was your follow-up? I had another ultrasound done within a short period of time, and it showed that the fibroid had grown. Right. So they said, oh, that's concerning. See a gynecologist. I went to a gynecologist. He immediately was able to rectify that I wasn't cancer. It wasn't a sarcoma, because fibroids by definition are benign, right? That's super important for people to know and learn and hear that said out loud, especially when they're newly diagnosed. Fibroids are not cancer. And so he was able to tell me, though, this is, even though it seems like rapid growth and you didn't know about it, and voila, all of a sudden it's big, it's not cancer. And we did a lot of observation, which there's nothing wrong with doing observation for fibroids. And prayerfully, I was able to get a medical team who did it in the right way. We did ultrasounds every 6 months. Not that everybody needs it that frequently, but I would say at least a year. As a provider now, I tell patients that are willing to observe their fibroids because they're gracefully living with them, right? This is benign pathology, to at least get imaging once a year to keep an eye on them. So we were doing images because I was early in my diagnosis. And it seemed like within that year of knowing that I had fibroids, everything just kind of blew open. I became extremely symptomatic after a while. I started to have extremely heavy bleeding, initially just once a month with my menses. And after a while, I was bleeding every 2 weeks, and not just bleeding, but hemorrhaging. I was a resident intern working 100-hour work weeks. I was tired. I was newly married. And I felt like that was just, par for the course, right? And I randomly asked my gynecologist to do blood work, just see what my levels are. I was living with a hemoglobin of 7.4 and a hematocrit of 24, working 100-hour work weeks and pushing through. Right? Because that's what we as women will do a lot of times, even knowing that this can't be right, that I'm bleeding every 2 weeks. And I used to not bleed because I was on continuous birth control. So we switched out birth controls a million times over, tried lots of different medications, nothing gave. The fibroids were obnoxious. And after a while, I had to look at surgery, even though I was in my 20s. And I was sent to who at the time was the best minimally invasive surgeon in my area, Dr. Furman Barreto. And he told me immediately that I wasn't a candidate for robotic or laparoscopic myomectomy, but I was a candidate for a myomectomy and to preserve my uterus. At the time, I had no children. And my uterus at this point was about 18 centimeters, which is almost 5 months pregnant, right? and I didn't even know it was there. And I had my surgery. I had my open myomectomy. And I would consider myself a great success story because after my open myomectomy, to speak to the fertility and pregnancy piece, I was able to get pregnant. Where my fibroids were, it was in a location where I would not have been able to because I had fibroids in my cavity. When it comes to pregnancy and fertility surrounding fibroids, the location of the fibroid matters more than anything else. Everybody thinks it's all about size, but you can have a very small 1-2 centimeter fibroids if it's in that fibroid, if it's in the cavity or the lining of the uterus, where we call it submucosal, that can impact fertility. And that's where mine was. So even not trying to get pregnant, it would have been nearly impossible for me to get an implantation, meaning the pregnancy to actually stick to the walls of my uterus and lining and allow it to grow, and then carry a pregnancy without miscarrying it, and allowing the baby to grow optimally without a fibroid taking up the space and pressing in and not allowing it to grow. Some of those are the impacts that fibroids can have on pregnancy and fertility. It can increase risk of preterm labor, preterm delivery. It can make pregnancy in and of itself more complicated. It can cause significant pain if there's degeneration of fibroids during the pregnancy. And it can also increase your risk of needing something like a cesarean section for delivery. There's also the other side of that. Remember, I said that many women live very gracefully with their fibroids to where they don't have any type of symptoms with the pregnancy, able to get pregnant very nicely and easily. Some women don't even find out they have fibroids until they get their first pregnancy ultrasound. And that is the beauty of understanding what's going on with our bodies, and that pregnancy is possible and capable, usually depending on the location of those fibroids. So I was able to get pregnant, had a beautiful baby boy, did it twice, and had 2 C-sections, because that's the other piece about fibroids and treatment options that is super important. Understanding where your fibroids are, how they're impacting you, what that means for fertility, if that's a desire. Not everybody desires that, but if that's a desire, how it might impact that. And then also, depending on that treatment option that you choose, what does that look like for delivery? I needed C-sections because of the myomectomy and the fact that my muscle was cut through and through to get to that one in the cavity. So I had my babies. I immediately, and Sateria will talk about this more after, during her discussion, but I immediately changed a lot of my lifestyles. I went natural, as you all can see. I stopped eating red meat, beef, pork. I very consciously decided to cut certain stressors out of my life. And I wanted to do, honestly, what I felt like was the best thing for me to help myself live a more balanced life, now knowing that my uterus is made fibroids and it can make it again. Okay, there's about, statistics show a 40 to 60% risk of regrowth of fibroids after intervention, even within 5 years. So when it comes to the time for you to talk to your doctors about, okay, this is how my fibroids are impacting me. These are my goals for management and treatment. This is what my future might look like. Usually that discussion is around fertility, and that timing matters because fibroids can regrow. Up until this point, I considered myself a part of the 40%, and I, was very proud to say my fibroids have not regrown. I'm doing well. I don't have any issues. But recently, I had a heavy cycle. And of course, being the doctor that I am, I did my own ultrasound, and I have found out that my fibroids have regrown, and they're not in the best locations again. But I have to rectify that. That's a part of the mental portion of having and knowing that you're a fibroid warrior. For me, mentally, I have to now make a decision about how to move forward, being done with my childbearing. My decision is going to be different than it was 11 years ago. The impact it's having on my life is different than it was 11 years ago. And the fact that I now have a very good understanding of what fibroids can be, and I'm a part of these type of discussions, I'm a part of these communities like the Fibroid Foundation that's going to give me the resources. It's a lot different than it was for me 11 years ago. So if for no other reason through this webinar, it's being able to share my journey. To me, it is extremely fulfilling, especially for my patients. One, because they feel like maybe I understand what they're going through. I do, but also to empower them to speak up about their symptoms, speak up about their desires, what their goals are, what their concerns are, speak up about what they want this journey in its perfect world to maybe look like for them, and then to understand what their true options and what the capability of this medical world that we live in and technology actually has for them. We have now ways that we can shrink fibroids. You know, there's an Acessa radiofrequency fibroid ablation procedure. There's one that's done hysteroscopically to do the same radiofrequency ablation. We can shrink fibroids. There's UFE, there's myomectomies, there's MRI focused ultrasounds. There are medications that are on the market now that can actually help decrease the heavy bleeding associated with fibroids, where you don't even have to have surgery at all if it's not right for right now. So when you go to your doctors and you talk to them about your symptoms, tell them everything that's happening, even if it's just like, my discharge is changing. We want to know, you know what I mean? Even if it's like, I just get a twinge on the right side every once in a while. It might be nothing, could be your fibroids, or could be a cyst, or it could be something else that we need to rule out. But tell them everything and tell them about your future goals, and be open to that discussion about more holistic and naturopathic options. What are your medication options? What are your procedure options, so that you can make sure that your goals align? Thank you guys so much again for having me. And I'm so looking forward to this very worthwhile conversation.
Wow. Thank you so much, Dr. Hawkins, for letting us get a peek into your story and into your journey. I do want to note, for those that are logging in today, please, if you're coming in live, you can submit questions at any time using the Q&A box at the bottom of your screen, and we'll try to address as many questions as we can during the panel discussion portion of the event. I'd now like to introduce Sateria Van Ebel to discuss her fibroids journey towards wellness that also prompted her to become an inventor and a national voice promoting awareness and wellness for women living with fibroids.
Greetings, everyone. It's such a pleasure to be with you all today. Thank you to SWHR, thank you, Irene, and thank you, Dr. Hawkins, for that personal and professional feedback that was stellar. Today, I'm going to talk about how fibroids have changed over my lifetime, and I'm going to talk about alternative approaches to fibroid care. I was a 26-year-old patient diagnosed with uterine fibroids and immediately told to have a hysterectomy, which I thought was odd. And being the fact finder that I am naturally, I sought out to find alternative treatment options. I have had 4 fibroid surgeries over the course of my fibroid care. I had 2 hysteroscopies, 1 open abdominal myomectomy, and UFE. My first hysteroscopy was not successful because the provider was not a skilled surgeon. So that taught me to make sure that I asked about my care provider's volume of fibroid treatment to make sure that they're skilled in any procedure that I would be undergoing with them. And I advise everyone to do the same. What I learned from that, after my 3rd surgery, I was feeling pretty vulnerable and still not understanding why fibroids weren't a buzzword, because they really had kind of taken over every area of my life. And so I started talking with women. And that's one thing that has really changed. When I started the Fibroid Foundation, or started these discussions, because the Fibroid Foundation was not an entity yet. This is 2007. You didn't talk about this openly, but I found out that when I started the conversation, people were just waiting to be able to share that they were struggling with the same thing. And that high incidence of receptivity told me that I was onto something. And so I just kind of tried to keep pressing forward to find answers that would hopefully not only help me, but help those that I knew, and perhaps even beyond me. From that conversation and from that investment in that inquiry into finding out how I could be an advocate for my own health, I've seen the conversation really open up and evolve over time, which I think is fantastic. It's refreshing. It's helping to erase the stigma around menstrual care in general, and it's moving us forward. And it's encouraging all of us, whether we have a uterus or not, to get involved in this conversation because we're all affected. I've also seen shared decision-making become a talking point. It's important to know that we're experts in our own bodies as patients. And when we couple that with our provider's expertise, it's called shared decision-making, where a customized treatment plan is developed based on those two fact sets, the patient's expertise, the provider's expertise coming together to form a treatment plan. And that's not something that was discussed earlier in my treatment or fibroids experience or journey. I've also found that we're just starting to have more conversations about the emotional needs, and Dr. Hawkins touched on this as well. And I look forward to seeing this conversation expand drastically as well. But I think the emotional toll is great. There's a societal impact because you're wearing dark colors, you're not moving through society like you normally would because you're afraid of embarrassment or being out and not feeling well, which is a miserable feeling. There's the diagnosis toll where you are trying to understand what you've just been diagnosed with. You're hearing lots of new terms for the first time, and it's a lot to wrap your mind around for anyone. And then there's the relationship toll. I think many of us have experienced significant others who didn't really know how to support us through our diagnosis. And so as we form that community support, that peer-to-peer support, we can talk about all of these things. And hopefully my hope and my prayer is that by raising my voice, I'm helping someone to not have to go through what I went through or to have to learn how to care for themselves the way that I have. So I hope that that helps someone listening today. I'll shift now to alternative medicine and complementary medicine approaches. And I'll start this by saying that I believe that we should have in our toolkit traditional medical experts as well as holistic. So, and the reason for that is that holistic remedies typically take longer for you to see results. And if you are compromised and having significant symptoms, you don't want to have an emergency situation and not have a medical care provider that you can easily reach out to for treatment. So it's important to have both. Over the course of my journey, I've tried a lot. And so I'll kind of go through these one by one to hopefully, again, shed some light on someone else's journey to be able to help them. I started off by working with a napropath, and it's Naprapath. The School of Naturopathy is based in Illinois, where I was living at the time in Chicago. And a friend told me to go see a Dr. Lynn Pittman, who was a napropath, and she adjusted my body head to toe and reduced my bleeding by probably about 70% or more. The only issue with that is when your spine recompresses, the bleeding returns, but Dr. Pittman really saved my life more than one time, and that's a resource that not many people know about. She also helped me with juicing when I was severely anemic. I had a hemoglobin of 6, and I was trying to raise my hemoglobin prior to surgery. She taught me how to juice with beet and carrot juice. I did supplement that with iron that has to be handled very carefully because you can only have so much iron daily. But these are tools that we have on our blog, and we try to share with the community so that they can care for themselves as well, because the beet and carrot juice doesn't constipate you, because the last thing that you want to have is more pelvic discomfort when you're facing fibroids discomfort already. Another thing I try, which is unusual, is Reiki. Reiki is an Eastern modality, of healing by touch. And I went to a Reiki therapist, and my symptoms abated for 2 months, and I became a believer. And so I became Reiki certified. And when my cramping would get really bad, I would do Reiki on myself, balance my chakras. And I still do that today for things like acid reflux, or if I have a relative in the hospital who's ill, I'll do Reiki on them while they're in the hospital. And it's just become a lifestyle of mine, a tool that I wholeheartedly believe in. So Reiki it's REIKI, is one of the tools that I use, the holistic tools. I also, because I didn't want to have surgery fought hard for that, I became a pescatarian. So I eliminated all meat from my diet. I eliminated soy and coffee for a period of 7 years. And I did see success, even though I had to have surgery there were the 7 years between surgeries 3 and 4 was the longest period of time that I had ever gone without a surgery. So it definitely slowed down the growth of the fibroids in my body. And I learned a lot from that, the power of food in your system, and how, I personally could see results or effects right away if I drank coffee. If I were tired and I had something with a lot of espresso, I could start bleeding immediately. So from that, I learned, pay attention to your body, because your body tells you exactly what you need to do. Chinese herbs. I tried Chinese herbs. I had some success with Bajinwan. But again, Chinese herbs can be dangerous if you don't know what you're doing, because they can compromise your liver. So you have to have a holistic expert. The same way you vet your medical experts, you must vet your holistic experts to guide you through that process with Chinese herbs. And then medical therapies. This is a medical tool, but it's a great tool to utilize if you don't have quick access to a fibroid specialist, if you're in a rural area, if you're recently diagnosed and you are trying to understand what's happening and you want to calm down your symptoms while you're making decisions about care. I think it's fantastic. It's a great bridge to menopause so that you can get through those fluctuations in your menstrual cycle without having to look at an additional surgery. So I hope that these tools have been helpful to you all, and I look forward to the Q&A session. Thank you so much.
Thank you, Soteria. These are only 2 of many empowering stories that call us to action to improve women's health and their experiences with fibroids. Thank you for sharing. And so at this time, I invite you to turn on your cameras and we will pin everybody up so that we can enter our panel discussion. Again, we invite participants to submit questions using the Q&A box at the bottom of their screen. We'll try to address as many individual questions and common themes as we can during this portion. Hopefully we can get to them all, or at least majority of them as they come in. I would like to open with a question for you both to answer just briefly, because you definitely touched on your own stories. And the question I wanted to ask to start off with, what is one personal lifestyle tip that you might like to offer someone who's new to learning about their fibroid diagnosis? And with that, before you answer, I do want to just make a note that part of the reason why we had this type of event is so that those that are listening can hear what has worked for our panelists and things that they know of. There is no prescribed way. We do not, we're not saying this will work and that won't work. SWHR is not giving any medical advice. However, we just wanted to provide an opportunity to see what someone's gone through, what has worked for them, so it can get your wheels turning and hopefully help you to discover and open up the conversation with your holistic provider, whichever health care provider you have, about your experience and what you're going through, and find that care plan that works for you. And so going back to that question, what is a personal lifestyle tip that you would like to offer to women out there who might have just learned about having a fibroid diagnosis?
Oh my goodness, there's so much. Like, one, that's really a huge challenge. one of the things, or two of the things that came to mind immediately were don't take a hot shower, because we immediately think that jumping in a hot shower will relax our bodies, which it will, but it will also make you bleed more. So again, just kind of looking at what you do day to day, what you might be eating, anything that changes the symptom in your body, causes your body to react, is something that you want to pay close attention to. That's a very tough question. I have many more, but I'll stop there.
I love it. I love all of them. So I kind of told you guys what I did for myself immediately after my treatment. I wish I did it immediately after my diagnosis, which would have been smarter timing. But I took my diet and the things that I was putting into my body. I started to just honestly examine that with a microscope. I started to read labels. I started to Google, ingredients and things that I ate. I cut out beef and pork, it sounds easy to do. I know it's not easy to do for everyone, but it is one of the simplest things that you can do to decrease some of the exogenous estrogen that you're feeding your body. I re-examined again processed food and my relationship with McDonald's, and do I really need McDonald's in my life? Do I really need canned foods in my life? If you think about what they have to do to get the shelf life of canned foods to just be able to stay on the shelf for years and years and years and years, a lot of preservatives are added to them. So those are probably potentially simple things that anyone could take. And then I will always 100% stress that cutting out stress is also something you may have more control of than you realize. Cutting out stressful activities, stressful people, stressful circumstances, all of that feeds into not only mentally how we process and go about our daily life, but our bodies, all the way down to our fibroids.
One more.
Thank you. Mm-hmm.
One more, yoga. The way that you can really replicate the relief that I got on my spine through my spinal treatments is yoga. And I know when you're hemorrhaging, it's hard to get down on the floor and keep from bleeding through your clothes, but I highly encourage you to the extent that you can. We've published some gentler stretches that you can do, but yoga is just amazing at keeping your spine and your pelvis. You want to keep your pelvis and your spine just really flexible, loose, open. And, when you get really tight spinally is when it can really cause some additional bad symptoms.
Wow. And, those are really great tips. And one of the things that we touched on earlier, which I'm sure a lot of women are also thinking about, and we got a question related to determining that vetting process, particularly with surgeons. How do you determine the skill level? Like, a lot of individuals will focus on their successes, but not where they have their gaps. So what types of things did you ask? And maybe even Soyini, from your standpoint, how do you communicate your experience, and also where you may not have experience when somebody wants you to do something?
Mm-hmm. So I'm a minimally invasive gynecological surgeon. Some people have never, ever heard of that term. I'm a subspecialist in the field of obstetrics and gynecology. I no longer deliver babies. I honestly, and this is not necessarily everyone's way that they practice or fashion to, or have the ability to design their practice, but I focus kind of wholeheartedly on surgery. So only people coming in my door are people who are considering surgery. Usually they've been diagnosed, they know what their symptoms are. They may have even tried other things, and now they want to do surgery. And the reason I became so specific, it didn't happen overnight, but over time, I found like that's where the need was, right? I feel like there's a lot of people that can get the diagnosis, start to get some management, but there weren't enough people that were offering minimally invasive options. So patients had a quicker turnaround, less pain, less complications with their surgeries. And so when I was having patients that were waiting 3 months to see me for my specialty, I started to taper on, I don't do annual exams and vaginitis and breast exams anymore. I only do surgery because the need is so great there for people that are specialized in it. So I tell a lot of patients, even when I talk on forums like this, or that might send me a message on IG, look for a specialist. Look for someone that has a special interest in whatever's going on with you. Special interest in PCOS, special interest in endometriosis, special interest in fibroids, because they're out there. We're out there. I did 2 years of fellowship training. After I had my surgery, I went back to the surgeon that did my surgery because he was the best in the game. And I said, teach me everything you know, because this is where I felt like I could make an impact on women going into, medicine. And I was very surgically inclined. So there are specialists. Definitely ask that question about their background and training, what their special interests are, maybe even what they've done research in. Not that it's absolutely necessary, but it can speak to their kind of, how they've diversified themselves to have an understanding that maybe not even everybody needs surgery, right? I can still talk to my patients about those medications that we addressed earlier. And then patients ask me all the time about my numbers. I have no problem sharing my numbers. I have no problems talking about previous complications that I've had. And I always encourage patients in doing that, also ask them about how they can be preventative, like what type of things do they do in surgery to try to prevent adhesions or bleeding or any complications. Those things, a surgeon that is confident in their skill set and have done this will be able to answer for them, and they're fair questions to ask.
So you can ask for the numbers as a patient. Okay.
I think that's phenomenal advice. And I'd add to go to a reputable advocacy organization and ask for a referral there. But then also still do your vetting process that Dr. Hawkins mentioned. Prior to there being fibroid advocacy organizations, I would get the Top Doctors magazine in the city in which I lived every year and read it like a Bible, because the top doctors are physicians' referrals to other physicians, basically who they would want to treat them or their family member. And again, still do your own research, even when you have that as a tool.
And that actually kind of segues us into the there's some questions around how can you find a doctor, and one other way is to check with your insurance provider as well to see who's a specialist in your area. And I like how you put it, someone who has special interests, because that means it's not just their skills, but their knowledge base is going to be a bit deeper in that area so that they can tell you more than you go to a surgeon. But like you said, because it's your interest, you also know the medications, you also know that. And so you can get, a little bit more in a consultation with them. We have our fibroids toolkit that I mentioned earlier at SWHR that we've posted online. We've dropped it in the chat, and I guess you can probably put that in the chat again, just for those that have come since. And we do have a list of questions to ask your doctor. We have some questions if you're considering surgery. We definitely recommend being as prepared going into your appointment as possible, because it can be very hard. And maybe you can speak to that as well. What questions do you want to answer? Or what questions do you want answered? But then when you're there, you're kind of flooded with all your experiences, what just happened last week versus what happened last month, waiting for your appointment. And then you get there and you're not able, and you walk away saying, oh, I wish I asked about this, or I wish I found this out in the 15 to 20 minutes that you had with the doctor. So we definitely have resources that we want to make available. And if you guys, do you know of any others that you might be able to quickly kind of put out there as far as finding a doctor or support? Of course, Fibroid Foundation. And we can actually include that in the chat as well, link to that.
I think it's important to go prepared to your visit. Go with your own questions. And I can't say enough about bedside manner. We have the, good fortune of having Dr. Hawkins in this panel, but not everyone has an opportunity to meet a caring yet skilled fibroid surgeon. And so if you feel uncomfortable, make sure you follow your gut instincts. When you go to your physician, you should be getting the right imaging. You should be being informed about your specific case, because every fibroids are like snowflakes. They display differently in every person. They're located in different locations. And so your case is unique. And when you visit with your provider, you should feel like you're being informed, like your questions are being answered, and a comfort level. I resisted surgery for a long time. I was very sick, and my reproductive endocrinologist drew a picture of how he was going to do my surgery, and actually had to hold my hand and say, Satira, you can't continue to live like this. So you have to continue to, just advocate for yourself, ask those questions, and, do everything you can to make sure that you're in good hands when you go into surgery, if you have to go into surgery.
And make sure that you have an understanding of what's going on. I can't stress that, enough, because sometimes the conversation is not the way that you envision it and what you want to hear. I have a lot of patients that come to me specifically for minimally invasive option. And the reality is that they're no longer a great candidate for it. It's not a safe surgery anymore. It's not that I'm not capable or skilled enough to do it. It's just I'm not going to do an unsafe procedure. But my patient is going to leave understanding why. They're going to understand their anatomy. They're going to understand their options and the pros and cons of all of them, even if it's not an option. So those type of conversations are, super important. And sometimes that takes 2 visits. I fashion my practice with this in mind. So every person that meets with me has 45 minutes. Not every doctor can give you 45 minutes to have this discussion and answer those questions, but they do need to be answered. So sometimes that's multiple visits to get to an understanding. But in that first visit, you need to be heard. In that first visit, I need to know you and what your desires are. And you need to get an understanding of what your anatomy and your options, at least on a superficial level, can be. And then to dig into those questions if you decide to have a surgery. What is the surgery actually in detail? How long is it going to take? What is my recovery going to look like? What do I need to buy and prepare? What it might look like at 3 months and 6 months? And then what does fertility look like in the future? Those type of things should be somewhere on that list of questions that the doctor should talk to you about before surgery. There's nothing worse than 3 months or 6 months later saying, I had no idea that this could happen.
I want us to touch on something that, as you manage, and we're in the workplace, and we're in the health space, but in the workplace, have you requested or received any accommodations at work that have helped you prevent, reduce, manage symptoms along the way? How have you dealt with that?
I think that that's an uncharted territory. To be perfectly honest, it has not been, there haven't been programs that have been developed at the level that we really need them to. Shameless plug, our 2022 initiative is Ask Her the Workplace Reset, where through all of 2022, we're going to be looking at and awarding a seal to those companies that provide menstrual care, fibroid care, and menopause support programs in the workplace. And Irene, some companies have started and created some programs, but those companies are few. I know that Kellogg just created a program, some UK companies, but that is something that we need a lot more of, because as Dr. Hawkins mentioned, there are so many people going to work in pain. I was in pain. I'm managing a huge construction job with a hemoglobin of 6.2. People do this every day. And I felt like I had no recourse to take a day off, or, address my symptoms, or even voice that I was having symptoms. So I'm so glad that you raised that as an issue, because it's something that moving forward, we definitely need to address. And we polled our community. That's one of the positive takeaways from the pandemic, is that our community shared that they did like working from home better because they didn't have that embarrassment. They had close proximity to a restroom. They could dress more comfortably. And those are all things that I think need to be taken into consideration to provide that flexibility as we transition more and more back into the workplace, to make sure that everyone's needs are being met.
Bravo. Oh my gosh. Bravo for highlighting the importance of that and recognizing companies that are doing that and who could set examples for other companies, right? Some of these big corporations, when it comes to, on my side, surgery, I tell patients, go to HR, let them know, because they otherwise wouldn't know that this is an issue, this is a problem, this is something that many of the women that are on their workforce are suffering with, but may be embarrassed or feel like it's taboo or not feel comfortable talking to their male boss or manager about. Make it something that we're able to normalize in the discussion, and that women feel emboldened and empowered to be able to say, yeah, today I might need a few more breaks. It was funny, I was doing a podcast with Girl Boss, and that was one of their like closing questions. It was like, rapid questions. And they said, when patients have fibroids and endometriosis, what are the things they need at work? And I said, they need a hot water bottle or a heating pad. They need some Motrin. They need a good girlfriend. They need someone that's going to have their back if they have to step out, or maybe that's going to check the chair behind them when they get up at the meeting, or say, honey, you got a little spot on your white pants that you wore to work today. Because we have to be a community about this thing, especially in the workplace. It's the only way that will allow the conversation to kind of grow, and for more organizations and companies to feel the need to be supportive of the woman that are taking care of them, to make sure that they're taken care of as well, no matter what the disease process might be.
I think you raised such a good point that even if there's nothing, continuing to say it will do the buzz. If enough women are going to HR and mentioning it, then eventually something will be like, we might need to address this if they keep hearing it consistently. And so I think there's the ground up work, but there's also a need for legislation. And so maybe Satira, can you talk a bit about legislation that's out there? I think there was a question that came in about the funding and legislation and it not being where it needs to be. But I know we have some work.
Absolutely right. Yeah.
And you guys are working
on asking that question. We are trying. There are many folks trying to get this legislation across. So where we are right now is we have had some success because fibroids has been added to appropriate. Fibroids language is in appropriations. We don't know what the funding level will be yet, but at least it is in appropriations for this session of Congress. There's also the fibroid bill, which has many co-sponsors, but we will need more for it to be able to have a successful passage. So we're waiting to see if that will happen during this Congress or whether we will have to encourage and support a reintroduction for the next Congress. We also would like to see fibroids language added back to the Defense Act to support those who are in the military. It was there was language in 2020 and it was removed. So what everyone listening can do to help is, the one question we are always asked is, who in my community would be helped by the passage of this funding? And so please write your legislators. We have a link on our website, because when you let them know that you're in their community and that this legislation and this funding would be serving one of their direct constituents, it makes a huge difference. And so that's kind of a snapshot of where we are. I know the Vice President's office is hosting a maternal health event tomorrow. And so those are wins. Those are huge wins when we have prominent, caring, empathetic legislators who are utilizing and sharing their platform to raise awareness of women's health needs.
Yes, SWHR, Fibroid Foundation, and many others that are coming together and doing this work. It is so important. It's so important. There is something I want to touch on, taking us a bit back to care, but also on that educational piece. You both mentioned how you've changed your diet and healthy living and lifestyles, which for someone who might not have a lot of resources, financial resources, what are some things that you can recommend for low income individual that are some things that they can do to add healthier bits or food or strategies to their lifestyle?
That's a really good question, Irene. I don't know that I have a lot of tools and feedback immediately in that regard, but it's always advised to shop the perimeters of the grocery store. And there are community gardens, community centers, community food resources that can help those in who may need assistance to be able to afford some of the foods that we've mentioned. So I would start there if you're in need to be able to do that. Sometimes in the right store, shopping the perimeter of the store rather than, as Dr. Hawkins mentioned, the canned foods can be less expensive than you might think. So gravitating toward whole foods, anything that comes out of the ground, anything that's naturally grown. And again, paying close attention to what triggers your body, because what triggers your body may not trigger someone else's. They may be able to ingest something and not have a reaction. But even you can even do a little journal of, I ate this and I had this reaction, to help you to stay on track.
Yeah, I was going to say the same thing about the community gardening, because I find that more and more communities are turning to that, to be communal and at the same time have that advantage of a more naturally grown and organic food source that is free after a while, free after the initial cost to get it started. And there's funding that's available for such resources and such initiatives in communities. And I think honestly, even if you go outside of community gardening, a lot of people don't realize that they can grow so much in their own homes. I mean, you should see my kitchen. I have a whole herb garden. I had to bring all of them inside to not get the frost. And so my window sill is like full of all types of herbs and and tomatoes and peppers and all types of things that are growing. So it doesn't have to be as complicated as we want to make it. Not to say that, ordering off of the dollar menus is a real thing for some people. That might be all that they're able to do. And so it's hard to say, okay, if you're telling me to cut out McDonald's, what am I going to replace it with? Because I have 5 children to feed and this is my fixed income, or I don't have an income. And so taking some of that control back and maybe even doing more in home or in small communities could be quite helpful.
I wanted to, we're wrapping up. I can't believe we're getting out of time. However, let's see where we can maybe do a closing. How about this? We have patients, researchers, clinicians, policy professionals, industry that are all watching this. And so in your final moments, what would you recommend to viewers to help them support or improve care for women living with fibroids? What is one thing that you often hear isn't done enough that maybe you want to highlight or amplify here today? Say, this is what we need. We've talked about legislation. We've definitely talked about, care, talking to your doctors. So something that we might not have talked in today that you'd like to remind folks at home.
I think what we've gotten here today, community, advocacy, sharing your story, talking about your personal journey. I have a number of patients that have heard either my story or someone else's story on Facebook or IG or YouTube or whatever, and it's empowered them and given them what they needed to kind of push themselves in a direction to say, yes, I'm a caretaker for my mother and father. And yes, I'm the mother and the wife and the boss and I'm everything to everyone else. Maybe it's time for me to take care of myself. Maybe it's time for me to stop ignoring what is actually impacting me and not making me my best for everyone else, right? If that's what's important to them. And so personal storytelling, giving impact to all of these advocacy associations and groups are super, super important. I felt like I didn't have that 11 years ago. I felt very alone. I felt very hidden and silenced in my fibroid journey. And now we have so much that we can give into. So each individual and each patient doing their own to find their way to help others. It makes you feel good. And it also will continue to encourage you along your journey, because so many of us share in our experiences and can feed into each other. So this is impactful. Doing more of this, to me, is the biggest way to make impact in our community.
And I think that we recently had discussions on the power of female researchers who may not always be able to lend their personal experience to their research, which is powerful. So if we have industry and clinicians listening who are in a position to be able to ask a woman or someone with a uterus who's a researcher to be able to pair their personal experience with their professional expertise, I think that's going to move the ball forward drastically. And I think that there are, not to exclude those without a uterus, but those people can ask those in their lives who are struggling with fibroids, who do have a history of menses, what their experience has been. Because when we have these conversations, it kind of opens the door for things to improve. You know, all the time I ask people or invite them to go ask the women in their lives about fibroids, and they come back and tell me they had no idea that their mother had a hysterectomy for fibroids, or that their sister had struggled and had been in so much pain. And I think when we have this conversation, then we know what we can do in our communities, in our jobs, or even in our families to provide that support to be able to try to improve this for everyone.
That is such great advice. We thank you so much for joining us today and sharing your experiences, your words of wisdom, and just in everything you had to. We hope that those joining were able to pull some nuggets, and that women were empowered from the information that was shared today. Thank you to our, those that have joined us today, and also to AbbVie, my Pfizer, and Roche, our sponsors, for their support of this event and SWHR's Uterine Fibroids program. We'd also like to thank everyone who contributed toward the development of SWHR's Uterine Fibroids Toolkit, a patient empowerment guide. And we invite you to go to our website and download this toolkit. We've dropped some different sections. It talks about treatment. It talks about wellness tips, also questions to ask your doctor, information about fibroids. And so all those who are watching, we also invite you to connect with us on social media. Visit our website, www.swhr.org, and download our toolkit as well as other resources, or you can sign up for our newsletter. Again, hashtag SWHR Talks Fibroids. Let's continue this conversation. Lastly, we'll send out an email to everyone with a recording of today's webinar for all registrants, so please be on the lookout for that. Thank you for joining us. Have a good rest of your day.